Good Tuesday afternoon. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director of the Knox County Health Department. Our moment of gratitude today is dedicated to the folks at Knox County Schools and the University of Tennessee for the work they are doing to try and mitigate the spread of disease on their campuses and in their schools during these challenging circumstances. From their current contact tracers to their health support staff, we know it's not easy, but we are so appreciative for the work that you're doing to make a difference in our community. Our real life example of putting the 5 core actions into play is going to a doctor's visit. First, we want to stress that doctors' offices and hospitals are safe places to go to seek care. So please do not delay care if you need it. Hospitals and doctors' offices are safe. If you are going to the doctor for an appointment, check with your doctor and see what precautions they have set in place. Many offices are requiring their patients to wear a mask upon entry. They may also require you to wait in your car and call you or text you when it is time to come in. Some offices are also specifying that you are not to bring anyone with you for your appointment. So check with your provider prior to going to your appointment if you were wanting someone to accompany you to the appointment. If you have a scheduled appointment unrelated to COVID, but are exhibiting symptoms like COVID, call your provider and see if you can reschedule for a time when you're feeling better. However, if you develop emergency symptoms, don't hesitate to seek care. Some doctors' offices are offering telehealth services. If that's something that feels more comfortable to you, call your provider and see what options they have. The bottom line is, do not put off your yearly checkups and appointments. These are important visits that can have a direct impact on your health. By practicing the 5 core actions, you can continue with your doctor's appointments while also protecting yourself and the ones around you. As a reminder, we are testing this week at the Jacob Building, today through Friday from 9 a.m. to 3 p.m. The Board of Health meets tomorrow via Zoom at 5 p.m. The public can view the meeting live on Knox County's YouTube page, the Knox County website, or on community television. Before we get into the local situation, we want to provide an update regarding how data is reported on our website, specifically the active and inactive categories. These changes were made in line with the Tennessee Department of Health, which are described in a new news release they sent out last week. First, it's important to note that as the medical and scientific community learns more about this novel virus, change can and should be expected. Previously, we had categories on our data page titled active cases and recovered cases. Early in the COVID-19 outbreak, public health teams conducted ongoing follow-up with cases to determine if a person had recovered. As case volume increased and long-term individual follow-up wasn't feasible, the Tennessee Department of Health and Knox County Health Department began applying a 21-day automatic cutoff for this definition. 21 days was selected based on what was known at the time about the infectivity of COVID-19. On our data page, recovered was further defined as those who were released from isolation and thought to no longer be contagious. Now, recent data from the CDC shows most patients are no longer infectious after 10 days. Although symptoms may linger for some time, therefore, we are now reporting inactive instead of recovered cases. This is in line with the Tennessee Department of Health. Inactive cases include those who are 14 days or more beyond their illness onset or their specimen collection date, for those who don't have symptoms. This better reflects what is now understood about the infectious period of COVID-19. Because of this change, reducing the inactive definition from 21 days to 14 days affects the number who are considered active. Therefore, that led to a larger increase in inactive cases as our data reporting system adapted to this update. This was the jump you likely noticed over the weekend. This does not have any change on the total number of confirmed cases or how we receive notification of cases. It is also important to note This does not affect isolation and quarantine requirements for individuals. We will continue to review our metrics alongside state and national information and work diligently to communicate these updates to our community. We have posted an update to our data page that explains this as well. Now we'll move to the local situation. We have 81 new confirmed cases since yesterday, giving us 7,656 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 274 probable cases. 6,014 of our cases are considered inactive, giving us 1,851 active cases. 293 individuals have been hospitalized at some point in their illness. Currently, there are 42 Knox County residents hospitalized with COVID. Unfortunately, we have one additional death related to COVID-19 to report, raising our total to 64. Over the weekend, we saw our highest one-day increase in new cases, with the majority of these cases falling in the 11 to 20 and 21 to 30-year-old age groups. We want to continue to stress the importance of following the 5 core actions in every situation. As school is now well underway, we want to remind students in our community that this means following these actions inside and outside the classroom. When you're hanging out with your friends, when you're going off campus for a gathering, eating lunch, doing homework together, the 5 core actions are still very important to follow. We do not want to see large increases of new cases like what we saw over the weekend. But the only way to move forward and see progress is as everyone works together practicing the 5 core actions consistently. Now I'll open it up for questions.
All right, the first question we have is from Alan with Inside of Knoxville. He says, can you please walk us through the changes in reporting which prompted the active case numbers to drop by about 800 this past weekend, and speak to how we might make comparisons regarding current levels going forward with levels for the first months given the changes?
So yeah, you really aren't going to be able to compare previous data to current data because of the change. So the change was implemented, as I explained previously, based on data and information that the CDC and other organizations learned about COVID-19, understanding better the period of infectivity of COVID-19, that people are really only contagious probably for about 10 days with COVID-19. So dropping that down. So the state decided to drop it down to 14 days, capturing some folks that might still be sick or feel badly for a few more days. So instead of counting somebody until they drop off at 21 days, we're now dropping them off of the active case count at 14 days. So what happened over the weekend is, as we transitioned to this new way of counting, those folks who were still in that category of 15 to 21 days in our active count got rolled over to the inactive count. So that really brought that count up quite a bit. And if you think about 2 weeks ago, or a little more, we had really high case counts then. So we were having, 100 plus cases a day. So when we pulled those folks out, it really made a big difference in our numbers. So what you'll have to, unfortunately, you'll have to compare just going forward. You won't be able to compare it to the old data. So we'll start looking at this going forward. It doesn't change the total number of cases per day. It doesn't change the rate of cases. It doesn't change anything about reporting. It doesn't change anything about isolation or quarantine.
All right, the next question also from Alan with Inside of Knoxville. Would it be possible for the number of UT cases which are included in the Knox County numbers to be reported? We know the number at UT and we know the Knox County numbers. We know they overlap, but we do not know to what extent. It makes it difficult to discern whether we are currently seeing a spike in the larger community or simply a specific spike at UT.
Well, I think for one thing, what I'll say is that everybody needs to remember we have COVID-19 all over Knox County. It's not just on campus. It's not just here or there. It is everywhere in Knox County. So that's really important for people to understand. And at this time, UT is reporting out their data. We're reporting out the countywide data. What I can say is that the majority of cases at UT are counted in our case count. If somebody is a UT student who decides to go home to a different county or even a different state, They'll stay in UT's count, but they'll drop out of our count. But the majority of those cases are Knox County residents because they're living here and going to school here. So they're staying here. So we're counting them in our cases.
Next question from Scott with Compass. The drop in active cases coincided with the change in categorization from recovered to inactive cases. Please explain the effect the change has on the number of cases in this category. Is there anything else you want to touch on?
Yeah, I feel like we've already answered that question.
Okay. Katie with WBIR, can you please share with us the work you're doing with UT right now on their student case counts and steps they're taking to stop the spread of COVID-19?
Sure. So steps they're taking, I'll kind of let them talk about that. They have a plan. They know much better than I do. But what I can talk about is how we're working with them to do case investigations and contact tracing. So those are two separate things. Case investigations means somebody who's positive that we call and have a pretty in-depth conversation with, asking them lots of things about where they've been and who they've been with and how long they were with those people, trying to determine who are their close contacts, who are people that are at risk for developing COVID-19. And then the contact tracing piece is about calling those folks and interviewing them as well, confirming that they really were with that person. Sometimes we learn there were other people there that the case forgot about. So it's pretty intricate. So we do the initial case investigation and coordinate with them the contact tracing, and we're communicating back and forth regularly with them. They've hired some folks to do that on campus. For the contacts off campus, we're doing that contact tracing. Actually, the state of Tennessee is doing that contact tracing. So it's a very collaborative effort. And you know what we want to encourage everybody, because we do that with all cases. This is not unique to UT or to Knox County schools. It's how we treat all cases. So we need the information so that we can protect the community. So encourage everybody to cooperate with our case investigators and our contact tracers when they call, and do the best you can to give us all the information we need to protect you and your family and your friends.
Katie's next question was, can you please share with us the work you're doing with Knox County schools right now on their student/staff case counts and steps they're taking to stop the spread of COVID-19?
So again, steps they're taking internally, those are their plans, and you can talk to them about that. Certainly, we've discussed those with them, but they've tweaked them and changed them, I'm sure, a little bit as the school year began and they realized they might have to change things. Very similar to UT, they have an internal team that's helping us with contact tracing within the school. We're doing contact tracing outside the school. So things that are outside school, like church or other things, we're doing those. We do the initial case investigation. We're talking to the team at Knox County Schools very regularly. And we're actually getting ready to dedicate some staff to work very directly with Knox County Schools. Contact tracing is complicated. It's not that simple, and it gets more complicated as you get, younger kids, and you have to rely on other people to tell you things and understanding, and you have to talk to mom and dad and stuff like that. So it gets a little more complicated since children and kids in Knox County schools are not of age. It also involves mom or dad talking to us and telling us what's going on, and sometimes involves the schools helping us understand who's where, who's sitting next to whom, and all of those things. So we work very closely with them, and we're very grateful for the help they're providing us and helping with some of that contact tracing within the schools. And I will say the other thing about both UT and Knox County schools is they have cases of things throughout the year where we have to work with them to do contact tracing, identify folks that are at risk, and take appropriate public health steps. So we already had those relationships in place, which made this COVID transition a lot easier.
From Megan with WBLT, what message would you have for UT students who do not understand why it is important to follow the 5 core actions? Can you explain the danger of attending or organizing large parties that do not include social distancing?
Sure, and this is not unique to UT students. This is for everybody out there who's listening. The 5 core actions really have to be followed all the time. The virus doesn't stop just because you're having a social event where all your friends are getting together. The virus doesn't say, "Oh, I'm not gonna spread there." The virus gets spread regardless of where you are or who you are. So the 5 core actions are really important. And if you're sitting there thinking, "Well, I'm pretty young, I'm pretty healthy, I don't need to worry about that," I want to remind folks that we have young, healthy people who end up in the hospital and severely ill, who with COVID-19, and there's The science will be out later on who really is at risk as we learn more. But just because you're young and healthy doesn't mean you can't have some complications secondary to COVID-19 and even long-term effects from that. So, and the other thing is when we talk about, maybe you're young and healthy, you won't have a very bad case, but if you go home and visit mom and dad, they may be older, they may have some chronic medical conditions, or you might visit your grandmother who's older and has chronic medical conditions. You don't want to put those folks at risk either. So it's really important that all of us practice the 5 core actions no matter where we are. And I know it's not fun. I mean, it's not fun. When I socialize, it's challenging to always remind yourself that you really got to observe those 5 core actions.
From Vincent with the Sentinel, do you track the number of people within quarantine or isolation within the county? And if so, would you provide those figures?
We actually don't track, we track isolation because those are cases. Quarantine, we don't really keep an active track of that. And actually the monitoring piece is being done by the state of Tennessee now. But the folks in isolation, those are our cases, and we certainly track those folks.
From Katie with WBIR, the governor said last week Tennessee might start getting a vaccine in November. How, if at all, would that work in Knox County?
Well, that's a great question. We actually have a team of folks looking at what that might look like for us. Way back when we didn't have COVID-19, some of you might remember that we have for more than 10 years done an in-school flu vaccination program. And because of that, we feel very well prepared to do mass vaccination events if we need to. The CDC and the state will decide what the guidelines are for who gets vaccine and how it's distributed. We will follow that as we did with H1N1. And we're talking with partners to get them enlisted to provide vaccine. I believe that getting more vaccine into more hands out there, not just in public health hands, but in providers' hands, will increase uptake and increase the number of people who get vaccinated. So we want to partner with our local providers. The state will be doing something similar with the larger providers. So we are planning. We don't know what it's going to look like because we don't even know what formulation will come out first. There's several different vaccines in the pipeline, and we're anxious to see how those trials go and when we are able to get vaccine.
From Katie with WBIR, can you speak to the surge in cases among 11 to 20-year-olds? They represented more than half of last week's new cases.
They sure do. So yeah, I mean, this speaks to school going back in session. We knew it was going to happen. And so again, I sound like a broken record, but when we go back to, it's really important for students, everyone, no matter what your age is, to practice the 5 core actions. And we know that some of these clusters and some of these cases that we have are a result of people not practicing 5 core actions when they're socializing. So it's really important to remember to practice the 5 core actions no matter what you're doing to reduce risk for yourself and others.
Also, with Katie with WBIR, what is the current turnaround time for test results?
Test results, at least our test results are coming back within 24 to 48 hours. I think local providers are seeing a similar turnaround time.
Another from Katie with WBIR. We've heard from a handful of people that high case counts don't matter. Can you talk about how those cases could translate into hospitalizations or even deaths?
Well, sure. We kind of spoke about that earlier. COVID-19 is a very serious illness. And, we've had several deaths in Knox County. Across the country, there have been several deaths. And we've seen people hospitalized from the young to the old. Most of those have been in the older folks, but it certainly happens in younger folks. So anyone can have a complication from COVID-19. People with chronic illness and older people are more likely to have them, but people without those conditions can also have complications. So spreading this disease is something that we really all as a community need to think about, and how do we do our part to reduce risk? There's been a lot of theory out there about herd immunity. Herd immunity is accomplished by vaccination, not by people getting sick. Honestly, we don't know very much about the immunity, the natural immunity, as we call it. So if you get COVID, the natural immunity is what you would get from the disease itself. We think it is pretty short-lived, maybe 3 months. We may learn more than that, but right now it looks like it's about 3 months. So that's not going to protect us for very long. And so herd immunity is accomplished by vaccination, not by people getting sick.
Also, Katie, with WBIR, usually KCHD is spraying for West Nile mosquitoes this time of year. Is the department doing the same this year? Have any of those mosquitoes been found, and have there already been spraying so far?
So we are testing still. We have our collection pools out like we always do. We're testing. We've only actually had one pool test positive, and that was last week and maybe 2 weeks ago. And we sprayed in that area. It's kind of over near the Carnes community in that general area. So we'll do that again if we find pools that are positive. The good news is we are capturing mosquitoes, but they're not positive. And I definitely can say from my backyard, we definitely have mosquitoes around Knox County.
And just as a note, a notification was sent out. I believe it was last week. We can send it out to you again so you can see the notification we put out about the area. Any other questions? Please go ahead and submit them now. From Brian Hornback, any reason to have the flu shot sooner?
You need to get the flu shot as soon as it's available. Your immune system is pretty amazing. No matter how old or young you are, our immune system has a memory. And so if you get the vaccination now and it's a relatively good match, if you get exposed to the flu, your immune system is going to be able to mobilize and protect you from getting very sick or getting the flu at all. So as soon as it's available to you, get the flu shot.
All right, any other questions? Please go ahead and type them in now. All right, not seeing any other questions appear, so thank you all for your time, and we will see you again on Thursday at 12:30. Have a good rest of your day.